Hi, it's Patrick Hutzel from IntensiveCareHotline.com, where we instantly improve the lives of families of critically ill patients in intensive care, so that you can have real power, real control, so that you can influence decision making even if you're not a doctor or a nurse in intensive care. In this week's blog, I want to show you 5 ways to have control, power and influence while your loved one is critically ill in intensive care. If your loved one has been admitted to intensive care and is critically ill, some of the most common feelings that families and relatives of critically ill patients in intensive care feel is the overwhelming fear, frustration, challenge, vulnerability, the loss of control, and worst of all, the feeling of helplessness and powerlessness. Furthermore, you and your family's mental strength is often tested to the maximum. But what's worst of all is that other people are in control of the situation and you are left powerless and you are unable to influence decision making unless you know what to do and what questions you need to ask, and also if you know what's happening in the background of an intensive care unit and how that is impacting directly or indirectly on the care your critically ill loved one is receiving or not receiving. Once you know what questions you need to ask, and once you know what's happening behind the scenes in an intensive care unit, you are very well positioned to have control, power and influence. And things will be so much easier from there on once you know what you don't know. If you don't know what questions to ask, and if you don't know what's happening in the background of an intensive care unit, you, your family and your critically ill loved one are at the mercy of the intensive care team, and the care that your critically ill loved one is receiving or not receiving is also directly linked to your level of control, power and influence that you have whilst your loved one is critically ill in intensive care. Your positioning is absolutely critical, and the solution to this massive dilemma is to know how to position yourself correctly so that you have control, power and influence whilst your loved one is critically ill in intensive care. Once you know how to position yourself correctly, once you know what questions you need to ask, and once you know what's happening behind the scenes in intensive care, your life will be so much easier and you are no longer at the mercy of the intensive care team, and you have real control, real power and you can influence decision making. Let's just say that you have just been told by the intensive care team that it would be quote unquote in the best interest for your critically loved one to quote unquote to withdraw treatment, or to quote unquote limit treatment, or to issue quote unquote not for resuscitation order for your critically ill loved one. The intensive care team often positions themselves as they know what's in the best interest for your critically ill loved one. But do they really know? Or do they only position themselves as the experts in the field of intensive care when they want to drive their agenda forward? And most importantly, how do you turn the situation around? How can you get to that all-important feeling of having control, power and influence? I'll give you the answers to that in just one moment here, but before we come to the answers, I just want to quickly remind you that you don't need to be a doctor or a nurse to be in control of your critically loved one's situation in intensive care. So here are the 5 ways to increase control, power and influence while your loved one is critically ill in intensive care. Number 1. Give yourself permission to be in control, to have power and to have influence. One of the biggest challenges of your loved one being critically ill in intensive care is that initially you often feel helpless, without control and without influence, because you think that other people have the authority and the decision-making power to decide what's best for your critically ill loved one. Those decisions are often not challenged or questioned, because many families of critically ill patients in intensive care think they lack the knowledge to get involved in decision making. Nothing could be further from the truth. And think about this for a minute. Do you really want to have other people running the show? Do you really want to have other people making decisions about your critically ill loved one's care and about your critically ill loved one's destiny without your input? I would certainly not, and I would certainly get involved in the decision making process. You might say or think, Patrick, I'm not a doctor or a nurse. How could I possibly get involved in the decision making process? The answer is simple and is directly related to you giving yourself permission to be in control, to have power and to have influence. The minute you give yourself permission to have control, power and influence, that's the minute the game changes, and that's when you get to the level of control, power and influence you deserve and you need. Henry Ford once famously said, "Whether you can or you can't, you are absolutely right." And the same applies to your situation, because yes, you can. Number 2, don't be intimidated by doctors and nurses. Whether you are aware of it or not, but on a conscious or on a subconscious level, you are intimidated by the intensive care team, and you feel like you and your critically ill loved one are at the mercy of the intensive care team. Stop being intimidated by the intensive care team and stop thinking that you and your critically ill loved one are at the mercy of the intensive care team. Nothing could be further from the truth, if you know what to do and what you need to believe in. It doesn't matter that they are doctors and nurses. Don't be intimidated by them. You and your family are more than worthy of having control, power and influence. Number 3, have a united family and speak with one voice. Make sure that your family is united during this time of crisis, and make sure that your family puts differences aside that may not align with your critically ill loved one's best interest. Put family disputes aside during your loved one's stay in intensive care. All that matters is your critically ill loved one's best interest and his or her recovery. Also, if you and your family are not united, and if you don't speak with one voice, the intensive care team will notice, and it'll be much easier for them to be in control and to drive their agenda. Number 4, ask the right questions. This is probably the most important part of it all. Know what questions to ask. By you asking the right questions, you will leverage your level of control, your level of power and your level of influence. Don't be afraid of asking the right questions, because by you asking the right questions, your level of control, your level of power and your level of influence will skyrocket. How do you know what questions to ask, and how do you know what the right questions are? In order to know what questions to ask, you need to, number 5, get our free reports. In our free reports, you learn quickly how to get real power and real control, and how you can influence decision making fast whilst your loved one is critically ill in intensive care. Our free reports help you with in-depth insight that you must know whilst your loved one is critically ill or is dying in intensive care. Sign up for your free membership and get your free instant impact report now. In your free instant impact report, you learn how to speak the secret intensive care language, so that the doctors and the nurses know straight away that you are an insider and that you know and understand what's really happening in intensive care. In our free reports, you'll also discover how to ask the doctors and the nurses the right questions, how to eliminate fear, frustration, stress, struggle and vulnerability, even if your loved one is dying. 5 killer tips and strategies helping you to get on the right path to control, power and influence in your situation. You will get crucial, behind the scenes insight, so that you understand what is really happening in intensive care. How you need to manage doctors and nurses in intensive care, and it's not what you think. With your free instant impact report, you'll also get 4 other free reports, and the reports you will be receiving are the 6 questions you need to ask the most senior doctor in intensive care, 10 things you didn't know doctors and nurses are talking about while you are not at the bedside with your loved one, the 7 answers to the 7 most frequently asked questions if your loved one is critically ill in intensive care, 9 myths of being a critically ill patient in intensive care. Thank you very much for tuning into this week's blog, and I'll see you again in another update next week. Make sure you also check out our Your Questions Answered section, or send me an email to support@intensivecarehotline.com with your questions. This is Patrick Hutzel from intensivecarehotline.com, and I'll see you again in another update next week.